Thank you everyone for taking the time out of your day to learn more about RxHearing and the recently passed OTC Hearing Aid Law. Hopefully you can gain a lot of useful information out of this. Brandon, everyone can see my presentation?
Yep, they sure can.
Fantastic, great, thank you. So before I kick things off, I always like to share a little bit of an experience with one of our recent pharmacies. This will give you an idea of really how we launch RxHearing within our partner pharmacies and how we can offer these OTC hearing aid solutions to your patients and patient community. So recently, one of our pharmacy partners launched with RxHearing. They received our RxHearing Care Station, which is basically a way for your patients to perform a hearing test at your location. One of their patients came through, they performed a hearing test and really validated that they were experiencing some moderate hearing loss. That individual had an opportunity to go through our options for our OTC hearing aids at the location with the pharmacy there. The pharmacy had a few options in terms of our hearing aid solutions. That patient purchased a hearing aid over the counter. They also scheduled a free consultation with one of our licensed hearing specialists through the Hearing Care Station. They went home. They joined a Zoom call with our licensed hearing specialist. They unboxed their hearing aids and actually put the hearing aids on during that consultation to learn more about how they can use the hearing aids, and had a couple questions about their hearing health and their hearing loss. Within just a few minutes of speaking with our licensed hearing specialist, this patient and this woman started crying during the Zoom call. And our licensed specialist, interrupted and had to ask what was going on. And she said she could hear her husband in the room next door ironing his shirt. And it's because she had our hearing aids on. It was a really nice experience. We know that, this is a solution that's going to work for her. So overall, a great experience for the patient, for us, the patient, with purchasing OTC hearing aids from RxHearing, saved several $100s. That pharmacy that provided that solution made the sale. It was our Audix Life pair of hearing aids. They made a margin of $250 off that sale, and we'll have a very, happy patient really moving forward. So with that, that'll give you an idea of kind of what we're going to go through in terms of this presentation and really how we can support your pharmacy and your patient community. So let's get things kicked off here. So let's talk about really just hearing loss in general. And there's two figures I really want to focus on here, guys. That is 38 million Americans currently suffer from hearing loss in the US today. And within that population, approximately 80% of hearing loss cases can be treated with OTC hearing aids. So the market is very big in terms of the type of impact we can have on a population that really is limited in terms of, or was limited in terms of their options for hearing aids. And why is this number so high? It's primarily because of accessibility and affordability. So we're trying to really disrupt that in terms of offering these OTC hearing aid solutions. Before, hearing aids were not covered by most health insurance policies. And at the same time, you had audiologists, in some cases, unscrupulous audiologists that were selling hearing aids sometimes for over $4,000 or $5,000 for a pair of hearing aids. Unfortunately, there's other options and other ways to go about purchasing hearing aids, and that's why the FDA and the U.S. Congress stepped in and passed legislation that will enable hearing aids to be sold over the counter specifically for those reasons, with affordability and accessibility. And also, just as important too, a lot of recent studies have come out that have shown the impact of hearing loss if left untreated. Two statistics that came out of a recent study is that 300% is an increased risk of falling that may result in injury. People really don't take care of their hearing health, as well as a 500% increased risk of developing dementia as well. So a lot of key factors come into play in terms of one's overall health and well-being if they really don't take care of their hearing health. So specifically with the FDA, hearing aids and the OTC hearing law, this is specifically taken from the FDA. So, I can just read it specifically so you can really understand what the FDA is trying to accomplish with this law. So this action establishes a new category of over-the-counter hearing aids, enabling consumers with perceived mild to moderate hearing impairment to purchase hearing aids directly from stores or online retailers without the need for a medical exam, prescription, or a fitting adjustment from an audiologist. What this means is your pharmacy or clinic can offer these OTC hearing aids without really having to go through the traditional means of having that patient seek out an audiologist or take, a traditional hearing test. This can all be done at your location in terms of having them take a hearing test through our hearing care station, as well as offering these OTC hearing aids. In terms of the overall benefits to your patients, it's really important because we know that with a lot of pharmacies today, you've become essentially the primary physician for a lot of your communities. Your patients are coming to you asking really a wide variety of different questions as it relates to their health. And I'm sure you're getting a lot of questions now as it relates to hearing aids and hearing health because of this new law that's in place. So, an immediate impact you can have on your patient community in terms of wearing hearing aids. Again, studies have proven that wearing hearing aids will improve their quality of life, mental health, relationship, memory, physical health, self-confidence, and productivity. So a lot of benefits when it comes to, again, simply wearing hearing aids. We want to make hearing aids as commonplace as, prescription glasses. There shouldn't be really, any adverse really pushback these days with hearing aids because they're becoming much more prevalent within, populations, senior populations. So what does this all mean for your pharmacy? Like, what does this OTC hearing aid law mean for you, for your patients? So again, really focus on their health and well-being, but also it enables you as a pharmacy to diversify your revenues, create a new profit center, advertise these new solutions within your community, as well as generate more foot traffic. So a lot of positive benefits for offering these services and solutions, and that's really where RxHearing wants to support you and help you market these solutions. A lot of questions that we get are, what are the differences between hearing aids that are sold, online through like Amazon and these other big box stores? What does it mean to sell hearing aids over the counter at your pharmacy, and then fitted through an audiologist? So through Amazon, if someone were to buy online, it's usually very transactional. They don't get the additional support from, say, a hearing specialist. These hearing aids that are sold, online through Amazon, for example, they're through a reseller, so you're never really sure like how the hearing aids are programmed, if they're programmed properly, if they may even potentially damage the individual's hearing. There's just not a lot of information when it's just purchased online. In terms of an audiologist, we always, one of our patients has a question that, that relates to a severe hearing loss or profound hearing loss. We always recommend that they, seek out, someone who can help them. That's a hearing specialist or an audiologist. And in some cases, those types of hearing aids would sell for a little bit more on the higher end because they need more amplification. But also, we provide you like a list of questions that will help identify the type of hearing loss, or if that individual needs to seek additional help, like if they have any pain in their ears, or if they have any fluid randomly coming out of their ears. It's really important that they seek out, again, a primary physician, an ENT, or an audiologist. Now, with our OTC hearing aids, it's really important to focus on, with the law, it's only for mild to moderate hearing loss. And because, it's 80% of the population, in most cases, our solution will be, a beneficial solution for that patient that would have a positive impact on their hearing loss. We do offer the licensed hearing care specialists. So if that person does have any questions about their hearing health, or they're their hearing test that they perform at your location, we can step in and help them there. We provide long-term hearing care, so if the person comes back a year later and has questions about their hearing loss, we're more than happy to help them there. So see us as really a single point hearing care solution for your pharmacy as well as for the patient. So what does that mean for you as an IPC pharmacy member? For all of our IPC members, we do provide what we call our RxHearing Care Welcome Kit. And this is a discount welcome kit that you can purchase for basically that will enable you to sell hearing aids over the counter, as well as you would receive a hearing care station from RxHearing that you can perform these tests at your location. We also provide an additional 10% discount off of our retail price for all of your pharmacy patients. So there are a multitude of benefits as being an IPC member that RxHearing wants to deliver to you. So a little bit more on RxHearing. I've been in the hearing aid industry now for about 8 years. My co-founder, Chuck Ottaviano, who unfortunately couldn't join the call today, he's been in the industry now for over 30 years. So a tremendous amount of experience when it comes to hearing aids and hearing care health. We also, again, have our licensed hearing specialist and an audiologist on our bench that we would be made available to your pharmacy as well as to your patients. So we've been in this industry for quite some time. RxHearing has been in business since 2018. But I was in preparation for when this legislation originally passed. It took the FDA some time to finally determine the criteria of what makes up an over-the-counter hearing aid. That was finally passed in October of this last year. So we've had a lot of experience with offering these solutions, not just to patients directly, but through senior living centers and through a variety of clinics. But now as pharmacies, you can offer these solutions. We're very well positioned, situated to offer these solutions, very seamlessly and make it very simple for you to integrate this platform into your pharmacy. So we're now currently offering a solution nationwide. We're in 50 locations. We're a preferred partner of IPC. We're bringing in IPC pharmacies. We're going to be at Idea Share there with IPC. So again, we're ramping up, and we certainly are seeing a lot of success with the pharmacies that we're currently working with. How do we provide these hearing aids at such a discount? It's because we actually work directly with our manufacturers. We're not just a reseller buying hearing aids and selling them out the back door. We're with our team, with our experience, we help design, we help engineer and manufacture our hearing aids directly with our partners. We also program our own hearing aids. So we do all the QC, quality control, and quality assurance on all of our hearing aids before we ship them out. And because we're direct with our manufacturer and we're direct with our pharmacy network, we're cutting out all the middlemen, and all those cost savings go both to your patients as well as enabling us to incentivize you as a pharmacy to generate those types of revenues and those types of profit margins that will create a lot of success for you guys. We're also constantly innovating, so we're investing in new features and new functionality that are out in the market today that you see in the higher end hearing aids in terms of Bluetooth connectivity, rechargeable hearing aids, pre-programmed, self-fitting, self-testing. We are providing, again, a high-end hearing aid solution that you're seeing in the market today, but at an affordable price. Also, we understand that this hearing aid industry is always really advancing in terms of technology. We want to make sure that the solutions that we're offering our pharmacies and our patients always keep pace with what's out there in the market today. So we're always investing in innovative solutions that we're constantly investing in. So as a pharmacy, what do you receive when you partner with RxHearing? So as I mentioned before, we have a welcome kit that we would provide through with IPC. This welcome kit includes our RxHearing Care Station with a set of headphones that are calibrated specifically for this station so people can perform these hearing tests. It also enables them to schedule the consultations with our specialists, but also just important, like how do you go about marketing these services? How do you do the outreach? How do you inform your patients? So we do provide custom label brochures for you to pass out for all of your patients. We do the bag stuffers. We do a lot of social media. So we also offer like the digital assets. If you want to do more traditional type print campaigns, we collaborate with you on that and help you subsidize those types of outreach strategies. So in terms of sales, this is also really important. You have the option to sell over the counter at your location, but also for anyone, let's say, takes home the brochure, isn't really sure if they want to buy hearing aids, or maybe they grab the brochure for a family member, we're able to track that referral based on the 10% discount code that I previously mentioned. Each pharmacy receives a specific discount code that's printed on all the materials. So if they come to our website and purchase a hearing aid directly from us, we would ship that hearing aid to your patient. And also in real time, you would be able to see that referral that results in a sale, and we would compensate you based on that promotional discount code. So it's really easy. It's fully transparent, and it's a real, I guess, alternative way to offer these types of hearing aids. In terms of training and onboarding, so when you receive our welcome kit, we schedule an hour-long training session, as well as onboarding on how to go about activating your station. We run through a variety of different hearing tests to really help you inform your patients about what it means to have mild hearing loss, moderate hearing loss, and then that level of more of a severe or profound hearing loss. We do have, beyond our licensed hearing specialists and solutions that we provide for mild to moderate, we can refer an audiologist to your pharmacy for anyone that falls out of that scope. Say they land in that severe hearing loss, I guess on the chart in terms of their hearing loss, we can assist that individual through our own referred audiologist. In terms of customer service, it's all based in the U.S. We also, provide all of our pharmacies and patients with an RxHearing Care phone app. So anytime, say one of your staff members has a question, they would have that app available on their phone, and we're able to quickly respond to any questions or inquiries from your patients. That's the same for any of your patients. If they download this app, we're very accessible in terms of customer support. So we understand the type of demographic that we're working with. They like to have, someone who's responsive, and if they have any questions about using these hearing aids, we're able to troubleshoot that there pretty quickly. So just to summarize again, simplicity, a seamless solution that's built for our IPC pharmacy members. Your patients have the option to take the online hearing test at your location. They have the option to schedule a live consultation with one of our licensed hearing specialists. But straightforward, they can come to your location. If you're advertising these services, they can buy over the counter, or you can refer them directly to our website, and then we handle the rest from there. So the ongoing customer care and support for anything that's hearing health related. So we really look forward to working with you guys. We're excited for this partnership with IPC and being one of their preferred vendors. And the goal with RxHearing again is really to offer that affordable and accessible hearing care solution to your patient community and provide a value-added service to your location. So with that, Brandon, I'll take any additional questions.
All right, sounds good there, Matt. Thank you very much. Yeah, sounds like it's a great opportunity for pharmacies now that that law has been passed there in August, this past August in 2022. We do have a question that came in from one of our attendees. How do we determine if the patient has mild to moderate hearing loss after they complete your hearing test at, say, our location, and if they're a candidate for your hearing aids?
Yeah, really good question. So Once that person completes the hearing test, we have an automated video that will play that will explain the different types of hearing loss. It will go through their hearing chart, as well as the different types of hearing aid solutions that would be available to them and that would be the best fit. So we really try and make it as simple as possible for that patient to identify the best solution for them. And then on top of that too, we do provide the additional training. So if the patient were to come to one of your staff members, we would be able to, that staff member should be able to speak really about the different types of hearing loss and what, again, the best solution would be for them. So again, try and make it as simple as possible.
Perfect. Okay. Yeah, thanks for answering that there, Matt. Another question I'm seeing here in the chat is, can you tell us how many hearing aids your most successful pharmacies are selling per month and what they're doing to be successful?
Yeah. So we have some pharmacies that are selling as many as 20 pairs of hearing aids a month. That's on the higher end. On the average, it's closer to about 8 pairs of hearing aids. And it really just depends on the type of initiative that they want to take into selling and marketing these new services. So the type of things that they're doing is, traditional print ads in their local newspaper. We have some pharmacies that are doing radio ads. Social media is really important. And these are all things that we would assist the pharmacy with, developing these type of campaigns. But the biggest part is, if there's a dedicated staff member on the pharmacy team that takes the initiative to learn more about hearing care and hearing health, and someone that we can help train, if they're more educated when it comes to these type of topics, we see a lot more activity from these sales. And again, really just in terms of customer support and the type of patients that they're bringing in, it's a real value-added relationship.
Last question comes from me. I'm curious, how do people sign up if they're interested, Matt?
Yeah. So we created a dedicated landing page for all of our IPC members. It's a simple form that they can fill out. There's a video that plays that goes into further detail about who RxHearing is, how we can help you, how we integrate this program into your pharmacy. You select the type of welcome kit you want. There's 3 options between, you can order just the station where you don't have any inventory at your location. And then we have 2 additional options. It's our standard and our premium welcome kits that will enable you to sell hearing aids over the counter. And yeah, it's straightforward. So once you complete that form, we'll follow up with you. We would send you the welcome kit. We schedule that training and onboarding session.
Excellent. I do have one more question here, Matt, that just came in. What is the price point? Cost, retail, margin, annual cost, things like that.
Yeah, so our hearing aids are very competitive. We have an entry-level hearing aid, which is known as our Invo. That starts at $399. That's more of a retail type hearing aid that sits all the way in the canal, all the way up to our flagship hearing aid, which is our Audix Life, which retails for $799. We have a mid-level hearing aid also. It's one that sits behind the ear. That's our Audix Max. That retails for $599. But remember, with all of our IPC pharmacy members, you get that additional 10% discount for all of your patients. So take 10% off of those retail prices. And then what does that mean for you for that sale? What is the margin per hearing device? So that initial one, the Invo, which is the $399, you would receive $100 on that margin. For our Audix Max, which is our mid-tier, $599, you'd receive $150, and then the Audix Life is $250 per sale. So, there is an incentive there, certainly, for you to offer these hearing aids over the counter, as well as by referral. And just to clarify, the margin remains the same. If it's over the counter or if it's by referral online, you would receive the same margin for both sales.
Okay, Matt, sounds good. Any other final things you want to add before we sign off here today?
I think that's it. I'm really looking forward to, working with IPC and your pharmacy members. This is, I think, really value-added campaign that we can offer, the pharmacies, as well as this is an overall major benefit for their patient community in terms of offering affordable OTC hearing aids. Certainly, provide the additional customer support. If you guys have any questions, we're happy to follow up.